Hello. Now, previously we did great. We progressed very well with. Now, previously when we were doing uh, the online video on maternal and newborn health, just generally, let me talk about midwifery. Okay, we tackle focus antenatal care, the visits, the first visits, and what are probable activity that are actually partaking on the process of those visits. So today we are going to continue with the same. And last time we checked on social history, the entire history of ANC. That is from family planning history, family history, social history, performing physical examination. I taught you how to do the Leopold's maneuver. Okay. We talked about the abdominal examination in terms of the signs of pregnancy, fetal size, growth, assessing fetal health, diagnosing and the location of fetal parts, detecting any deviation from normal. All those ones we checked. We even did the Paul Wilkes grip, which was the fourth leopard maneuver, which I told you the lower pole of uterus is grasped with the right hand, the midway facing the woman's head, and then feel the occiput and input, not which one is low. Okay. So today we're going to check on auscultation. Now on auscultation, the most important thing you should know is that this is just we use listening as a technique. So you need to hear. You check fetal heart by hearing, rate and rhythm by hearing, and then you count for 1 minute if regular. If regular, that is normal. If it's regular, it's questionable. So you have to find the fetal heart. And in fact, if you don't find the fetal heart, it's very important you refer the mother to ultrasound or any other scanning so that you can check on the health of the fetus. Check the rate and the rhythm from your ears. You can be able to count and feel if the rate is consistent because we know it's supposed to be at around 100, let me say 100 to 150 beats per minute. Okay. So mostly the method that is used is peanut stethoscope, and hand should never touch it while listening because your hands, when you touch the peanut stethoscope, your hand will produce sound, so your ear will not be able to listen well. So ear must be in close form contact with the stethoscope. So ear must be in close form contact with the stethoscope, very very close. And you remember that during abdominal examination the client must be asked to empty her bladder and then to lie on her back on a couch with the arms by her side. So then inspect the abdomen for the shape, size, scars, and fetal movement. Then you check on the any abnormality detected. Then you refer for further investigation. You can refer for doctor's review, you can refer for ultrasound or gynecological review. Okay, so you need to estimate the height of the fundus and compare to the calculated EDD. This helps you to assess fetal growth and detect any deviation from the normal. Because if the expected EDD is January 26th, 2026, and today is maybe 25th August 2025, then you should be able to know that from today up to January is roughly 5 months. So the baby should be around 3 months, 4 months there. Okay. So when you check on the fundal height using using your hand technotape measure, you should be averagely at exact expected rate as per the EDD. Okay. So check the for varicosity at the back of the leg. Also ask the woman to remove any tight clothing at the leg. And at this time, it is also important to check for phlebitis, that is inflammation of the vein, by just looking for any reddened areas. Prepare the side of the abdomen to locate the fetal back in order to determine the position. Okay. So once you get the part of the fetus which is plain or regular and lacks no protrusion of parts, limbs, or that is always the back. When you are touching or palpating on the front of the fetus, you realize they are protrusion, they are limbs. Okay, so it's irregular. So you do this by facing the patient and then supporting the uterus with your right hand, and then you keep pushing the fetus with your left hand toward the right. Reverse the order to feel the left side of the uterus. So then, with that, you'll palpate the lower pole of the uterus, just above the pelvic brim. Ask the mother to bend her knees slightly in order to relax the abdominal muscles, and ask her to breathe steadily with her mouth open. Okay. Yeah, so facing the foot of the bed, you need to mark the brim of the pelvis with your hands and then you cap what presents between them. If the head is presenting, a smooth surface will be felt. If you do not find the head in the pelvic brim or at the fundus, suspect a transverse lie. This will be significant only after the 36th week of gestation. Below 36 week of gestation, that should not give you any worry. Why? Because the baby can eventually change in position later. There's still a lot of time during, when, let's say, 20 weeks, or you realize that in this one in 30 weeks, or maybe 28 weeks. Before 36, you should not be worried. But 36th week, it will be very hard for the baby to give a cephalic presentation within that time. So transverse lie is always, you should take it very key, and then you should check through it. So the fetal heart sounds are listened to last, so as to assess the fetal well-being. The peanut stethoscope, the I say, the peanut fetal stethoscope is commonly used to hear the fetal heart. And as you perform the physical examination, talk to the mother and check her facial reaction as you palpate the abdomen. When you complete the procedure, reassure the mother. Okay. So gestation age, which is estimated as per the size of the fundal height, or the funders, the fundal height. So it's always Eli, which refers to the relation. So when you're checking on the gestation height, check on the fundal lie. When checking on the lie, relationship between the long axis of the fetus and that of the mother, and can either be longitudinal, transverse, or oblique. Okay. Another important thing, let me try and zoom so that you can be able to see what I'm presenting. So attitude, it just is a relationship of the fetal head and limbs to its trunk. It's most commonly flexion. Okay. Then presentation, which means the fetal part that is lie at the pelvic brim or in the lower pole of the uterus, and can either be vertex, okay, bridge, face, shoulder, or brow. So can be vertex, presentation, bridge, face, shoulder, brow. Mostly we talk about vertex. Okay, so the most common is the vertex. Now the vertex, brow, face, all referred to as head presentation. So denominator is the name given to the presenting part. For example, occiput for vertex, sacrum for bridge, and mentum for face. Okay, so that is that. So position, which refers to the relationship between the denominator of the presentation and the landmarks of the pelvic brim. So other component of physical examination include the pelvic assessment, can be achieved through X-ray of the pelvis, or clinical assessing sign of contracted pelvic, like head fitting. Okay. Now, genitourinary system, you check on the frequency of micturition for abdominal discharge. Circulatory system, check on varicosity, varicose vein may occur in the legs, anus, hemorrhoids, and vulva. Vulva, of course, are rare and very painful. So we have things to do with the vulva, like vulva warts, purulent, irritating discharge. And then the lower limb, you just check on the bones alignment and deformity. If you have any deformity, you need to report. So keep pitting edema in the lower limbs by applying fingertip pressure for 10 seconds over the tibial bone. You can do on the tibial bone or the middle malleolus. Okay. Laboratory tests, just the way I told you initially, is just the NC profile. So these tests are like just urinalysis, which we check for protein, glucose, and ketones. Hemoglobin levels, we check on the HBs to assure us or give us, the stability of, the oxygen supply to the mother, so we don't fear for syncope or fainting cases. VDRL for syphilis, because syphilis can be congenitally acquired by the fetus. Okay. Now, and it can cause some sort of conditions such as blindness, can affect the eyes and many other organs of the baby. So, rhesus factor, we check that one to assure us for the rhesus factor compatibility. Therefore, we don't have the agglutination, the newborn. Okay. And then blood group, we check that one as well for compatibility. And then malarial tests also being checked, TB screening as well, because with that, pregnancy can also result to what we call the immune compromisation. So with that, after realizing or getting the screening done, you're good to go. So yeah, so advantages of antenatal visit. One, we are going to check. So there are some health messages which the mother is supposed to be told. Okay, you need to give some. You need to assure the mother. You should tell them the advantages of antenatal visit, the advantages of using treated nets, drug compliance, use of tetanus toxoid vaccine, advantages of rest and exercise. Clothing should be comfortable, breast care, diet and nutrition, rich in iron and protein. Okay, individualized birth plan, counsel for HIV if they are HIVs. Those are all important. Okay, and then you need to also educate the mother on the danger signs during pregnancy, like probability of vaginal bleeding. If in case there is any sign of vaginal bleeding, let the mother report to the facility immediately. Convulsions or fits, because those can be primary cases or signs of preeclampsia, okay, which are very, very fatal when it comes to pregnancy. Reduced fetal movement, those are danger signs, can be indicating of, intrauterine fetal demise, okay, IUFD. Persistent frontal or recurring headaches, those are also ascertaining hypertension, which can be gestational hypertension, which of course is also a primary sign of preeclampsia, a condition associated with pregnancy. So severe abdominal pain as well, those can be sign of, miscarriage or threatened abortion or something or so. Pain at the calf muscles indicating DVT, deep venous thrombosis. Sudden swelling of the body can show edema, and that is also a danger sign. Rupture of the membrane, that is also very dangerous, can be premature rupture, which can result to, premature delivery. So premature onset of contraction as well. Forced smelling vaginal discharge can be as a result of STI or any other infection. So those are danger signs, okay. Blood vision can be a sign of hypertension, high blood pressure, that is, and therefore should be noted or maybe reported immediately. Excessive nausea and vomiting as well. Fever, edema. Fever above 38 degrees Celsius is very, very dangerous, because it can be indicating maybe a fatal organ failure, maybe systemic infection, or something else which can be very dangerous. Excessive nausea and vomiting can be hypergravidarum, hyperemesis, which should be managed in the facility. So, in the FNC, focus on natal care, which you always give for very special people who have got some predisposing factors. Yeah, you should advise on individualized birth plan. Give tetanus toxoid, give IFAS, that is iron and folic acid supplement. Give, sulfamoxazole promethamphetamine if more than 16 visits for prophylaxis of malaria. Okay, screen for TB, refer if necessary. That is on the first visit. So on the second visit, take history, perform physical examination. They are told you, check on individual's birth plan, give a fast, give SP, sculptate for fetal heart sound, counsel and educate the mother, refer if necessary. The third focus antenatal clinic visit, take history, perform physical examination, check on individual plan, give IFAS, give SP, okay, give tetanus. But when you're giving on the third visit, SP you give on DOT, direct observation therapy, okay, yeah, observe therapy. Give tetanus toxoid 4 weeks from first dose, okay, and then auscultate for fetal heart sound, counsel and educate the mother, refer if necessary. On fourth, FNC, take history, perform physical examination, update on individual's birth plan, give IFAT, look for anemia, check fetal presentation, do vaginal examination, auscultate for fetal heart sound, counsel and educate the mother, then you refer if necessary. Okay, that is that. Now, we are going to handle pathophysiological changes and minor disorders during pregnancy. That one we are going to take on the next time we do MNH, that is maternal newborn health or midwifery. We are going to check on the reproductive organs, the cardiovascular system, the respiratory system, the renal system, the gastrointestinal system, maternal weight, and musculoskeletal system. The skin. So those are very key things that you should not forget. So right away you can get us, follow us in YouTube. Get to learn by seeing. You see, when you're watching our videos, is more educative than listening to the WhatsApp audio. Prepare for example that small piece. Always be the winner.